Good morning, children. Today we will study about the chemistry in everyday life. This is the last chapter of class 12th. Drugs. Classification of drugs, drug target, dark target interaction, enzymes as drug target, receptors as drug target, types of drugs, chemicals in food, cleansing agents. Drugs. Children, chemical substances of natural or synthetic origin which are used for curing diseases and reducing suffering from pain are called drugs or medicines. A drug is a chemical substance which cures the disease but is habit forming, causes addiction, and has serious side effects, while a medicine is a chemical substance which cures the disease, is safe to use, has negligible toxicity, and does not cause any addiction. Classification of drugs. Drugs can be classified in a number of ways. On the basis of pharmacological effect, it is used by the doctors as it provides a wide range of drugs available for the treatment of a particular type of problem. For example, analgesics have pain killing effects on the basis of drug action. It is based on the action of a drug on a particular biochemical process. For example, all histamines inhibit the action of the compound. Next, on the basis of chemical structures, drugs classified in a way share common structural features and often have similar pharmacological activity. For example, sulfonamides have common structural feature. Now you can see in the slide. Now next type of drugs, that is on the basis of molecular targets. Drugs usually interact with biomolecules such as lipids, proteins. These are called target molecules or drug targets. Drug possessing some common structural features may have the same mechanism of action on target. Drug target interaction. How the drug interact with the body. Macromolecules of biological origin performs various functions in the body. Proteins, which perform the whole of biological catalyst in the body, are called enzymes. Those proteins which are crucial to communication system in the body are called receptors. Those proteins which carry polar molecules across the membranes are called carrier proteins. Enzymes as drug target. Catalytic action of enzymes. The first function of an enzyme is to hold the substrate for a chemical reaction. Active sites of enzyme hold the substrate molecule in a suitable position so that it can be attacked by the reagent effectively. The second function of an enzyme is to provide functional groups that will attack the substrate and carry out the chemical reaction. You can see there is an active site in which the enzyme gets fits and holding the substrate. Drug enzyme interaction. Drug inhibit the attachment of substrate on the active site of enzyme in two different ways. Drugs compete with the natural substrate for their attachment in the active sites of enzyme. Such drugs are called competitive inhibitors. Now you can see in the slide, substrate is not getting attached to the enzyme. In place of that, drugs get attached. Now next, some drugs do not bind to the enzyme's active site. These bind to a different site of enzyme which is called allosteric site. This binding of inhibitor at allosteric site changes the shape of the active site in such a way that substrate cannot recognize it. Now you can th- these changes the active sites. Now receptors as drug targets. Receptors are proteins which are crucial to the communication system in the body. Majority of these are embedded in cell membranes in such a way that their small part possessing the active site projects out on the surface of the membrane and opens in the outside region of the cell membrane. In the body, message between two neurons and that between neurons to muscles is communicated through certain chemicals. These chemicals known as chemical messengers I received at the chemical messengers are received at the binding sites of receptor proteins to accommodate a messenger shape of the receptor site changes. This brings out this brings about the transfer of message into the cell. Thus chemical messenger gives message to the cell without entering the types of drugs. Antacids, those substances which neutralizes the excess acid and raise the pH of an appropriate level in the stomach are called antacids. Most commonly used antacids are sodium bicarbonate, magnesium hydroxide, etc. You can see the structures also. Some important drugs: cimetidine, ranitidine. Drugs used recently: omeprazole, lansoprazole. Antihistamines, the hypersensitivity of some persons to some drugs, dust, pollen grains, cat fur, etc. is called allergy and is due to release of a substance called histamines in the body. The drug which interfere with the natural action of histamine by competing the histamine for binding sites of receptor where histamine exert its effect are called antihistamines or anti-allergic drugs. The antihistamines which are widely used are bromophenyramiine, dimetap, dimetan. That is the structure you can see, uh, terfenadine or neurological active drugs, tranquilizers, drugs which are used for the treatment of stress, fatigue, mild and severe mental diseases are called tranquilizers. They relieve anxiety, stress, irritability by inducing a sense of well being. If a person suffers from depression, in such antidepressant drugs cases in such cases, antidepressant drugs are used. The important antidepressant drugs are ipronoside, phenelzine. Analgesics. Analgesics, neurologically active drugs which reduce or abolish pain without causing impairment of impairment of consciousness, mental confusion, incoordination or paralysis or some other disturbance or disorder of the nervous system are called analgesics. These can be classified in two categories: non narcotic, non addictive analgesics. Non narcotic analgesics are medications used to control pain and inflammation. Non narcotic are used to treat acute or persistent pain that is mild to moderate. They also may be used in combination with other medications or therapies to treat moderate to severe pain. For example, aspirin, Motrin, or Advil, ibuprofen, and Aleve or naproxen. Narcotic analgesics. Narcotic are medications that mimic the activity of endorphins, endorphins substances produced by the body to control pain. Narcotic are used to treat acute pain related to surgery and other medical procedures such as for persistence chronic and breakthrough pain that is moderate to severe. Morphine and many of its homologues, when administered in the medical doses, relieve pain and produce sleep. In poisonous doses, these produce stupor, coma, and ultimately death. Rexenol, that is morphine, it is usually given to the cancer patients. Codeine, dolophane, methadone, and heroin. Antimicrobials, drugs which are used to cure diseases caused by microbes or microorganisms such as bacteria, viruses, fungi, etc., are called antimicrobials. Antibiotics, these are chemical substances which, in low concentration, either kill or inhibit the growth of microorganisms by intervening in their metabolic processes. The first antibiotic was penicillin. Its structure is this. Antibiotics, antiseptics, and disinfectants. Antiseptics are the chemical substances which prevent the growth of microorganisms and may even kill them. They are safe to be applied to living tissues. Commonly used antiseptics, Dettol is a mixture of chloroxylenol and terpineol, furescin and soframycin, etc. Disinfectants are chemical substances which kill microorganisms but are not safe to be applied to the living tissues. These are applied to inanimate objects such as floors, drainage system, etc. 1% solution of phenol work as disinfectant, 0.2 to 0.4 ppm in aqueous solution of chlorine, and low concentration of sulfur dioxide are anti-fertility drugs, chemical substances which are used to check pregnancy in women, are called anti-fertility drugs or birth control pills or oral contraceptives. These control the female menstrual cycle and ovulation. Some of the commonly used pills contain a mixture of norethindrone, progesterone derivative, and novestrol or ethinylestradiol, and estrogen. All such drugs are expected to have side effects and hence should be used under proper medical advice. Chemicals in food. All those chemicals which are added to food to improve its keeping qualities, appearance, taste, odor, and nutritive value are called food additives. Some important food additives are food colors, flavors and sweeteners, fat emulsifiers and stabilizing agents, flavor improves, anti-scaling agent and bleaches, antioxidants, preservatives, nutritional supplements such as minerals, vitamins, and amino artificial sweetening agents. Sucrose and fructose are the most widely used natural sweeteners, but they add to our calorie intake and promote tooth decay. To avoid these problems, many people take artificial sweeteners. Some important artificial sweeteners are saccharin, O-sulfobenzenimide. It is the first most popular artificial sweetener. It has been used as a sweetening agent. Since it is insoluble in water, therefore it is sold in the market as its soluble sodium or calcium salt. It is about 550 times sweeter than aspartame. It is one of the most successful and widely used artificial sweetener. It is roughly 100 times as sweet as sucrose. It decomposes at baking or cooking temperature and hence can be used only in cold drinks and cold foods. Its structure is like this. Allitame. It is similar to aspartame, however more stable than aspartame. It is about 2000 times as sweet as sucrose. Food preservatives. Chemical substances which are used to protect food against bacteria, yeast, and molds are called food preservatives. Some common preservatives are sodium benzoate. It is used in soft drinks and acidic foods. Sodium metabiphosphite. It is used as a preservative for products such as jams, squashes, pickles, etc. Sorbic acid and its salts. It is used for controlling the growth of yeast and molds in products like cheese, baked food, etc. Epoxides. These are highly effective in preservation of low moisture food. It is mainly used for preservation of spices, nuts, and dry fruits. Para-hydroxybenzoate ester, they have no perceptible effect on flavor and are effective in inhibiting the growth of molds and yeast but are less effective on bacteria. Cleansing agents. Cleansing agents can be defined as natural or synthetic substances that are used to assist the cleaning process. Cleaning is primarily the removal of dirt and dust. Chemical substances which concentrate at the surface of the solution or interfaces form surface films, reduce surface tension of the solution, and help in moving dirt and dust by emulsifying grease are called surface active agents or surfactants. This active agent contains two groups, one oil loving lipophilic and the other water loving hydrophilic. These are of two types, soaps and synthetic. We get glycerol, which is used as a hydrating. Synthetic detergents. Soap less soap are cleansing agents which have all the properties of soaps but which actually do not contain any soap. These the Since these are synthetic substances, therefore they are called synthetic detergents or detergents. Detergents may be defined as ammonia sulfate salts of long chain hydrocarbons containing 12 to 18 carbon atoms. Types of detergents. Detergents are of three types: anionic detergents, cationic detergents, and non ionic. Non-ionic detergents. These do not contain any ions in their constitution. One such detergent is formed when stearic acid reacts with polyethylene glycol. Stearic acid react with polyethylene glycol and form the non-ionic detergent. Liquid dishwashing detergents are non-ionic type detergents. Mechanism of clinic action of this type of detergent is the same as that of soap. Thank you.